feeding tubes. Feeding tubes are used to provide nutrition and hydration to a person who is not able to swallow adequately their oral intake. A trach tube is passed through the abdominal wall, therefore the skin is penetrated, and it's very important for skin and sight care to be done on a regular basis in order for the skin integrity to remain intact and for the prevention of infection. The PEG tube is the most commonly used long-term feeding tube. A gastrostomy tube, or they're called G-tubes, have a balloon in the intestinal lumen. The balloon is inflated with sterile water and prevents the tube from coming out or from dislocating. On the distal end of the G-tube, there is an infusion port where the medication and formula would go in, and then there is a port where the balloon would be inflated. A J-tube or jejunostomy tube does not have a balloon, but it is stitched in place in order for it not to come out. Feeding tubes are recommended for people who are at risk of aspiration, who cannot tolerate, who are intolerant of gastric feeding, and for those with malabsorption problems. Some cautions or alert for people with feeding tubes. Some medications and formulas may interact with one another, reducing the effectiveness of the medication or causing side effects of the formula. Follow the specific directions for the formula and medication as far as times to give and when and the amounts to give regarding any medication and feeding. The flush volume, the water that is used to flush a feeding tube, depends on the size and volume of the tubing, the fluid requirements or the fluid restrictions of the person, and the age and size of the person. The amount of water, the flush volume, is to be ordered by the doctor. If a feeding tube becomes dislodged or is not correctly placed, please contact the parent or the guardian before you administer any feeding or medication. Administration of enteral nutrition through a feeding tube supplies nutrients to the person who is unable to safely consume adequate nutrition orally. The choice for the feeding solution is determined by the physician. Medications and feedings may interact and could reduce the effectiveness of the medication or cause some side effects. Be sure to follow the doctor's directions specifically. Administration of feeding. Gather the necessary supplies and equipment before you administer a feeding. You will need gloves if those are used. You'll need the correct formula, a feeding bag or a 60 milliliter syringe, a feeding pump and feeding bag if that is ordered, and a 20 milliliter or 30 milliliter syringe in order to check the placement of the feeding tube. Always make sure that you are using the correct amount or the correct formula and the correct amount of formula. Wash your hands and put on gloves. Check the placement of the feeding tube. For gastric feedings, the person should be in an upright position or at least at a 30 to 45 degree angle. This decreases the chance of aspiration, which is swallowing a formula into the lungs. It's especially important with somebody who has a problem with gastric esophageal reflux. For continuous feeds, you would close the clamp on the gastric feeding bag and pour up to 4 hours of room temperature formula into the bag. You should only have out 4 hours of formula at a time in order to prevent the growth of bacteria in the formula if it is at room temperature for longer than 4 hours at a time. Prime the tubing, purge the system of air, and load the administration set into the feeding pump if you're going to be doing a continuous feed using a feeding pump. Check for gastro residuals before starting the feeding. Attach the syringe, one of the 20 or 30 milliliter syringes, to the tube and gently aspirate contents from the stomach. This helps to determine the stomach's readiness for the feeding and confirms that the tube is in the right place. Flush the tubing with the prescribed amount of water. The flush volume, or the amount of water that you use to flush the tube, depends on the size and volume of the tubing, the fluid requirements or the fluid restrictions of the child, and the age and size of the person. Again, the amount of water to be used for a flush is to be ordered by the medical doctor. Connect the feeding bag to the distal end of the feeding tube, or connect if you're using a large syringe, connect that to the feeding tube, or to the feeding tube extension if you're using a feeding tube extension. Once you have done that, remove your gloves and wash your hands thoroughly. To begin the feeding, by way of pump, set the prescribed infusion rate, the amount that they are to get per hour, and then start the pump. Remember to always prime the tubing so that you are not allowing a large amount of air to go into the stomach, which would cause discomfort to the person. If it is by way of bolus, then you would use the 60 milliliter syringe, attach that to the feeding tube, and pour the formula into the syringe, allowing it to flow into the stomach by gravity. Never force this in with the plunger from the syringe. If it is a large amount that is to be bolused, a feeding bag can be used for a bolus. After you have hung the feeding bag, make sure that you label and date that. Change the bag every 24 hours. Be sure to wash your syringe, your equipment, with soapy water, and rinse with clear water in between using it. Also, if you're using an extension tubing, an extension feeding tubing that connects to the tube, make sure you wash those with warm soap and water. Administer water boluses as ordered. This helps to keep the person hydrated. The formula that they receive in the feeding may not provide enough hydration, and so this is important to meet their fluid requirements for a day. To administer a medication, stop the feeding pump, flush the tubing with water, administer the medication, and then flush the tubing with water again. Flushing the tubing prevents clogging, and it also helps to keep the formula and the medication from mixing with one another. Hold the feeding before and after a medication for the number of minutes or half hour as prescribed by the physician. This prevents an intervention with the feeding and the medication. Declogging the tube if the tube were to become clogged. Using a 20 milliliter or a 30 milliliter syringe attached to the end of the feeding tube, attempt to aspirate or pull out fluid from the stomach contents. If you are unable to do that, put 5 milliliters, 5 cc's of water into the syringe, or 5 milliliters of a carbonated beverage such as a cola or ginger ale, and attempt to instill that using the plunger with gentle pressure. Attempt with a back and forth motion to instill that in through the tubing and into the stomach. Clamp the tube and wait 10 to 15 minutes. Try to aspirate or flush the tubing again. If this method fails, do not force water into the stomach and through the tube. Instead, contact the parent or guardian and before you attempt to administer any feeding or medication. Flushing with water as ordered on a regular basis helps to prevent the tubing from becoming clogged. If you have any problems with the feeding or with giving the medication, make sure that you always report this to the parent or to the guardian. Administration of the feeding and care of the feeding tube. Just some additional or a recap on some pointers. The equipment and supplies should always be stored in a clean and sanitary area. Does not have to be sterile, but should be clean and sanitary. Always verify the type of formula that you are giving, the amount or the volume that is to be given, the rate and the duration, the time that you give it, how much you give it, and the amount of water that is used before and after the feedings, and the parameters regarding the residual. Always use good hand hygiene. Wash your hands thoroughly before you begin. Put on gloves if those are used. This prevents the transfer of microorganisms and helps protect the person from bacteria. Always check the placement of the feeding tube by aspirating contents prior to giving any medication or feeding. By checking to see if it is in the right place, you are preventing the feeding solution from going into the esophagus or the lungs and being aspirated. The care of the feeding tube and the stoma site. Collect all the necessary equipment before you begin to do the care of the site. You'll need gloves, a gauze, some Q-tips, split 4x4s or a split dressing, skin barrier if that is ordered, and tape if necessary. After you gather your supplies, be certain that you wash your hands thoroughly and then put on gloves. Remove any old dressing that is around the stoma. Check for any skin redness, rash, edema, drainage, or excessive granulation tissue or very red tissue. Assess the skin for any redness or broken area. Skin that is intact, we want it to not have any abrasions at all, because skin that is intact is the first line of prevention against infections. Clean the skin around the stoma site with the ordered cleaning solution. This might be soap and water, or it might be another solution. Be certain to use what is ordered for your particular consumer. If you're using soap and water, just moisten the gauze and some Q-tips. Wipe the area closest to the stoma and then gently move out from the stoma in a clockwise manner. Wipe the skin around the stoma with the gauzes and then rinse with just clear water. Dry the skin with a gauze pad. If the person has a PEG tube, be sure that the disc next to the skin is not too tight or causing too much pressure or irritation against the skin. If ordered, use a skin barrier, but use only what is ordered by the physician. If a dressing is ordered, then put a split dressing around the area. If a dressing is used, check periodically during the day to make sure that the dressing is not moist. If it is moist, it would need to be removed and replaced. Remove your gloves and wash your hands at this time. With the feeding tube, you want to always protect the skin around that area. During feedings also, be sure to observe for any signs of aspiration, that the contents from the stomach have been swallowed into the lungs. Some of the signs would be difficulty in breathing, turning blue, being tired or fatigued, increased sleepiness or decreased alertness. This is what would be above or below the baseline for your consumer. If you do have any problems with the feeding, be sure to report these to the parent or guardian. Be certain that the person is positioned at least 30 to 45 degree angle for the feeding. This also helps to prevent aspiration. Before you administer the feeding or give medications, always check for the correct placement by aspirating contents from the stomach. Use a 20 or 30 milliliter syringe and gently aspirate contents. Depending on the developmental level and the cognitive ability of your consumer, if it's appropriate to his or her age and understanding, ask them to report to you if they have any nausea, if they have abdominal fullness, or any cramping. This could indicate a problem with the feeding. Again, report any unusual signs or any difficulties to the parent or guardian. Always follow the orders as written by the medical doctor. Thank you.